Hello. I come to you today with my vision for the future. It is that we live in a world that no matter who and where we are, we're all able to access the safe, effective, high quality, appropriate and affordable medications we need at the time we need them to achieve better health. Sounds simple and fundamental, right? After all, we all have someone we care about, or it might even be ourselves, who avoided an illness altogether with the help of medications, or whose life was saved by taking a medication, or maybe is currently alive today with the help of medications. But as a pharmacist, I have watched as too many patients make the hard decisions to choose between food and their medications because they simply could not afford both. Like one of my patients, a 45-year-old working mother of 4 who had uncontrolled diabetes and 2 of her children had severe asthma. She had anywhere between $200 to $300 per month to spend on both food and medications for her entire family of 6. But the medications they needed alone far exceeded that amount. I would watch her every month as she would come to the pharmacy. She'd stand by the counter and sort through her cart of groceries, often deciding with tears in her eyes between what food and what medications she was able to buy that month. I've seen patients travel for hours, even days, to arrive at the closest medical center and be left waiting to get the medications they need. Or even worse, get turned away because there is simply no medication to give. And the list of these stories goes on. So to achieve the vision I've mentioned, more must be done, and I believe we all have a role to play. Now, since starting my journey in healthcare and public health more than 16 years ago, I've traveled around the world and worked with various organizations and health systems on strategies to improve the healthcare sector, with a greater focus on medications. I've worked in pharmacies, academic institutions, hospitals, corporate and public health settings, and one topic was clear in all of those: the struggle to access medications. It didn't matter if it was low, middle, or high-income countries. The issue was the same. We all may know someone who struggled to obtain a medication they need. It truly affects us all. The World Health Organization estimates that 2 billion people globally still lack access to essential medications. These are medications that could save lives, prevent illness and suffering, and allow these individuals a chance at living a better quality of life. But the conversations with the various institutions didn't just focus on patients struggling to access medications. They also focused on how the institutions responsible for providing those medications were also struggling. In the US, almost 70% of hospital pharmacy leaders surveyed in 2018 reported not having at least 50 medications they needed. And 94% of pharmacy staff in another survey in 2017 reported rationing or restricting medications that were in short supply. The US total prescription spending is estimated to have reached $456 billion in 2017. This is comparable to the full economies of some developed countries. As a pharmacist and an academic who's seen this in practice, researches this, and teaches this in the classroom, I've always been interested in understanding how we can increase access to medications and uphold the rational use of these medications for both individuals as well as the health systems that need them. We know that medications only work if patients take them, but accessing the medication is the first step. It allows these individuals a chance to reap the intended benefits of medications. The topic of access, though, is particularly complex. It's multidimensional and multifaceted. We have to ensure that those that don't have access get and maintain access, and those that do have access are able to maintain access. Research has shown that a lack of access to medications can lead to reduced health outcomes, reduced quality of life, and even life-threatening complications. And they've also increased healthcare costs considerably. But our efforts to increase access remain insufficient. So today, while you're with me, I want to walk you through 2 current realities pertaining to access to medications for both health systems and patients, and share with you 8 key lessons I've learned to highlight what we need moving forward. Now, the pharmacy supply chain is quite complex and global. It's a sequence of many moving, interdependent parts, and it involves numerous diverse stakeholders. Couple that with vulnerable and fragmented healthcare environments. Simply put, the health system and healthcare provider reality focuses on ensuring that they have the medications they need on their shelves to administer or dispense to the patients they serve. Whether the health system and the healthcare provider receives the medication is dependent on all the various stakeholders responsible for providing that medication. So this includes the manufacturers, distributors, wholesalers, etc. The patient reality focuses on ensuring that the patient gets the medication. To get the patient the medication, the healthcare system and healthcare provider must provide the medication, and the patient must receive it. So this brings us to lesson 1. This is not just healthcare's problem. We're all part of the patient sphere, so therefore we all play an integral role in crafting the solutions. Let's dig a little deeper and discuss 2 examples of current situations that have impacted access to medications, one for each reality, starting with the patient reality. You walk in to see your doctor, and after going through a series of questions, your doctor determines whether you need a medication. Now, if the doctor worries that you might not be able to access the medication, maybe due to cost, which is a major factor for many, they may provide you a free drug sample, if the option is available to them. Drug samples are often brand name medications provided directly to physicians and not to pharmacists to give to patients, and are used by pharmaceutical companies as a key marketing tool in the United States. Although they are free, there are negative consequences of these drug samples as they are. Studies have shown time and time again that providing drug samples influences physician prescribing behaviors. Physicians are more likely to later prescribe the more expensive brand name drug that they previously gave as a free sample. This makes a big difference in patients with chronic conditions who have to take a medication for long periods of time, often for much longer than what's provided as a drug sample, which is usually a few months of therapy at best. Hence, the downstream effects are higher out-of-pocket expenses for both patients and payers, as well as potentially lower quality of care, as the patient may be receiving a drug other than those recommended by guidelines, merely because it's available. Research has suggested that while it's intended that drug samples go to those in financial need, often they don't. The question as to whether these samples are really a safety net has continued to incite dialogue on the actual benefits of such a strategy. The debates over the potential benefits and risks of drug samples have concerned many healthcare establishments and have led them to restrict or ban drug samples altogether. But what if we could leverage that influence and instead also provide a drug that works but costs less? My colleagues and I were eager to understand and quantify the benefits of banning these free brand samples. However, we were also interested to see if there were other sampling approaches that could be used to assist patients in accessing medications. When the patent and exclusivity of a branded medication expires, companies can make a generic, which is identical to the brand in terms of active ingredient, dosage, safety, quality, and performance, and are usually much cheaper. The idea of introducing generic drug samples, which is an idea not yet implemented across institutions, which have the same influence on prescribing patterns that brand samples have, may address the concerns of rising costs and still allow access to medications. So we evaluated the cost-effectiveness of 3 drug sampling scenarios in hypothetical patients who were over the age of 65, previously had a heart attack, and needed to take a chronic medication to treat their high cholesterol. We found that the generic sampling strategy was the dominant strategy. It had better health outcomes and cost less compared to the others. The next best strategy was banning samples, and lastly was the brand sampling strategy. This highlights that generic sampling strategies may serve as an additional path forward to both providing patients the medications as well as potentially saving payers millions of dollars per year. And with the leading worldwide killers being chronic non-communicable diseases, we should consider how patients with these conditions could benefit from such a strategy. So this brings us to lesson 2. What you give for free makes a difference. As we build safety net programs and initiatives with an underlying free component, and there are multiple options, like in the case of brand versus generic samples, we must also evaluate the influence and burden of such programs on access, quality, costs, and outcomes. As for health systems, we can see them struggling to obtain medications when they experience drug shortages. A drug shortage, defined by the American Society of Health System Pharmacists, is a supply issue that affects how the pharmacy prepares or dispenses a drug product or influences patient care when a prescriber must use an alternative agent. Drug shortages are becoming increasingly prevalent, affecting hundreds of medications, and are considered a public health crisis across the globe, significantly impacting how we access and manage care. Drug shortages occur across the globe, and I've seen the weight of this issue on both health systems and patients as they face the numerous challenges of obtaining medications. We've seen shortages of antibiotics, cancer treatments, surgery and cardiovascular medications, and even normal saline, which is just sterile salt water used daily in health systems. And these are just a few. If you walk into emergency rooms here in the United States, 90% of ER physicians surveyed reported not having the critical medications they need to treat these urgent patients. And if you need a surgery in general, well, we're seeing longer operating room and recovery times, or the procedures are being delayed or canceled altogether as a result of shortages. In addition to the added costs of acquiring medications during shortages, managing drug shortages within health systems consumes a significant amount of healthcare personnel time. The additional costs of both of these alone account for hundreds of millions of dollars annually. Now, the manufacturing and distribution of medications is a multinational process. The FDA has reported that almost 80% of active ingredients and 40% of finished medications come from sources outside of the United States. So this brings us to lesson 3. Continuous access to all the medications needed is not a guarantee, regardless of your location or how important the drug may be. Data generated by numerous organizations and stakeholders, including a study that my colleagues and I conducted to evaluate the impact of drug shortages, have shed light on the crisis nationally, calling for greater efforts to tackle the issue. So, in 2012, legislation was passed in the United States to give the FDA more authority to combat drug shortages. The FDA Safety and Innovation Act assists the FDA to avert drug shortages by requiring early notification from manufacturers of a potential shortage or interruption in production. The FDA cannot force a company to make a drug. The FDA has reported that over 1,000 drug shortages have been averted since 2011. This is progress, but shortages are still occurring at an alarming frequency and continue to have a significant impact. So this brings us to lesson 4. We need more information, transparency, and accountability. The more information we have, the more we can do. We've been able to avert numerous drug shortages with the help of early notification and more information. More information also helps health systems manage drug shortages. We have to continue to focus our efforts on improving what and how we communicate beneficial information. Experts have called on the World Health Organization to develop a global medicine shortage notification system to detect causes as well as to detect shortages as well as understand causes, which will help drive solutions in all countries. We have to continue to adapt and expand our policies and practices on multiple levels to allow for greater transparency and accountability. Now, for both realities, this brings us to lesson 5. This is not a one-discipline problem. Therefore, we must continue to find new creative ways to ensure that all the diverse stakeholders involved, including you, have a seat on the table to help create solutions. We must make sure that people are in the conversation and not just the subject of the conversation. We must continue our efforts to understand various stakeholder incentives, identify shared interests, and create a collective plan forward. Our solutions will not just come through the healthcare space. We need experts and innovators in the world of business, technology, science, engineering, law, communication. That's all of you to work side by side to create solutions. Now, it's important not to overlook the complexity of this issue. So this brings us to lesson 6. There's no one solution that will fix it all, or else I wouldn't be here today giving this talk. We have to identify the appropriate strategies to address multiple issues and realities at the same time, both locally and globally. we must also evaluate the ripple effects of each decision and intervention on the whole system to see if it enables or hinders access and at what cost. Lesson 7. Our goal is to achieve better health and not just provide better health care. Merely having access is not a guarantee for improved health. We know that there's more to an individual's health than the health care we provide them. This reality poses a challenge for all of us, as we must all step up and address the numerous social determinants of health that are negatively impacting our well-being. And finally, Lesson 8, the core of this talk, and it is that everyone has a role. Now, there are a number of diverse stakeholders and players that have stepped up and are at the forefront of addressing access to medication concerns, and their efforts to minimize the impact of this crisis must be recognized. But I believe we all have a role to play. Whether you're trying to get the medication you or your loved one needs, or you're advocating for more national and international policies and interventions to improve access, you have a crucial role in helping create solutions. Start by reaching out to your friends and your loved ones, see if anyone's struggling to get the medications they need, and educate yourself on the issues at hand. Speak up, ask your own questions, help find solutions, and share those solutions with others. Your insights, experiences, and perspectives can help shape policies. Organizations recognize this. For example, the FDA has recognized that the voice of the patient is integral to drug development and holds several public hearings in order to gather patient experiences and perspectives on the impact of their disease and discuss what treatments are available to them. Until we create another medical intervention more powerful than medications to prevent and treat disease, medications will continue to be an integral part of healthcare delivery. I have a vision, and today I'm using my voice. I ask that if you share this vision, use your voice and your influence. It's up to all of us, with or without expertise in the field, to expect better, demand better, and work to make it better for our patients, our loved ones, our communities, and globally. Thank you.